mostly as a doctors in Somaliland, we don't discuss anything about the STI. The people who are living here, they don't like to hear the word of sexual because, it is haram or prohibited.
There is a lot of patients, those have a sexual transmitted disease in our country, in Somaliland, but it's not easy to identify.
It's something that we don't ask in our culture. I feel it's difficult to talk about sexual history to the patients as well as colleagues.
So it's a big challenge to find a way. How do you ask this question and how do you explain to them about this disease?
My name is Zienab, and I am a doctor at Hargeisa Group Hospital. When I was young, always I was thinking that being a doctor is the most important job that kind of person get, because always you are going to help someone. Community in Somaliland, they don't think that the women can be a doctor, and even if she become a doctor, she's wasting her time because she can't work like a man. So it takes a lot of effort for you to become a female doctor. My family and friends was there for me and they helped me, and I work hard, so I become finally a doctor.
I met Zienab in 2014 when I travelled to Hargeisa to deliver the King's Leadership and Professionalism course. I instantly connected with her, having chosen a project in sexual health, which really is quite closely tied to obs and gynae. I knew that we were going to form this relationship and it was going to be the start of something that we would carry on into the future.
I was one of the lucky doctors who get this chance. So in order to complete the course, you need to do an audit. And previously I discovered there's a problem. So I developed a questionnaire and I distributed 33 of doctors.
Zienab in her audit highlighted that the vast majority of junior doctors wouldn't take a sexual health history and examination in patients that were at high risk of sexual transmitted infections, which I thought was astounding.
Actually, I didn't surprise the result because I know that if I do this audit, the result will be shocking from a lot of people, but didn't shock it for me because I know it was a problem.
With talking about sexually transmitted infections to either patients or non-patients, whether or not that's in the UK or Somaliland, these are really sensitive and personal conditions. Without that discussion, without being able to openly talk about transmission, then there is a risk that you might have epidemics of certain infections in small communities.
The number of people who are suffering from STD in a child is not small, they are big. There's a lot of patients in HIV where I work who didn't come for medicine because of stigma, and they end up either having infertility or sometimes they have been admitted to the hospital with a permanent disability, having sinus infection, and they have a permanent weakness. And most of them, they die. Everybody is at risk to get sexual transmitted disease. Any person can be infected from any time in their life. So in order to save those who are suffering from now, to save the people who are at a risk to get the infection, I like to talk about STD, because STD is a problem. So since it is a problem, why we can't talk? The reason we are a doctor is to help the people. So if we are not going to do, who is going to do?
After learning about the results that Zienab highlighted to us, I knew that the partnership had to do something about it. So one of the ways in which we wanted to combat this and to open up the discussion to make it easier to talk about sexual health was by having this online course.
The online course is some kind of unique course on a page called Medicine Africa.
Medicine Africa is an online classroom which is text-based, which brings together health workers in Somaliland as well as health workers that are volunteering in the UK.
The junior doctors who are currently working in the Hargeisa Group Hospital, they need to be a trainer.
In drawing up the course content, I had to work closely with Zienab to make sure that we were tailor-making a course that was appropriate for Somaliland. She is a junior doctor on the ground. She knows what's going on there. She knows what the problems are that the junior doctors face.
What are sexual transmitted diseases? How you are going to take a good history from a patient you thinking she or he may have a STD disease. How you can go for examination, and finally how you can arise or increase the awareness in the community.
Despite being thousands of miles away, in different rooms, different countries, Zienab and I co-taught the tutorials, and it worked brilliantly.
The course helped me because it's online. I can access it from any place because in night time it's difficult for women to go outside the home.
We got a lot of knowledge easily in our homes, and this is very important for us as a junior doctors.
Once you gave the participants a safe place to talk about all these sensitive issues, then actually you could see that everyone was willing to contribute to the discussion. There's no judgment, anyone can type whatever they want. It's easier to ask questions about difficult topics, and I think that's what makes it really important, that we've managed to find a way of teaching a difficult subject really easy.
So this course helped me to realize the symptom and sign of this disease, to ask him to the patient, not to ignore him.
I hope that these doctors who get the opportunity will teach the others, so the contribution will become more, and the partnership will become more powerful as it is now. If I turn to the idea of one doctor, at least it is a doctor can treat and diagnose many patients. So if these patients get a right treatment and the right diagnosis, I know some of my community or my people are safe.
This partnership illustrates that a collaborative relationship is one of the most important things when you want to work in global health.
This partnership is very important and can make a lot of changes and improvement in Somaliland. I couldn't have done all this without art.
We actually hope that in the future it's the local Somaliland doctors that take the lead on this, independent of our involvement, and don't essentially require us, which would be the future goal.
Being a doctor is a matter of serving to the public people, because that's why you are a doctor. You don't become a doctor for yourself, you become a doctor for your community.
We are not aid workers, we're doctors. We aren't paid to do this, we do it for free because it's critically important. We both identified a problem, we both designed a solution and delivered that solution to the junior doctors. These junior doctors are the future of the Somaliland healthcare system. Working together with them on this project has been such a privilege.
I'm really hopeful to the future, but there's still a long way to go.